So by way of introduction to the concepts of fish surgery, I thought it might be worth mentioning that anesthetizing the fish is probably the easiest part. If you think about it, the anesthetic is applied to the water, and there's several different kinds of anesthetic that you can use. One of them is an oil. It's my favorite because it's easily obtained, and it's called oil of cloves. And I can explain how that's used later, but this video isn't exactly about talking you through how to perform a minor surgery. It's basically just to provide you with a kind of an overview or summary of sort of what's going on with surgery and give you a highlighted view. So I may have mentioned I've done surgery on fish for more than a decade. I wouldn't say that I've done hundreds of surgeries, maybe close, I guess. Going into the abdomen, there's a lot of different things that you might do. Koi and goldfish sometimes get what is called egg impaction, where they can't deliver their eggs. I discussed that in another video, the video on dropsy. But egg impaction is one reason why you might end up going in surgically into the abdomen of a fish. Tumors in the abdomen sometimes are a good reason to go in. Fluid-filled kidneys, swim bladder surgeries. Went into a bass, great big trophy-sized bass, to remove a fish hook that had screwed up the air bladder. That was a very interesting case. I think it actually ultimately ended up doing very well. Anyway, that's a long story. But let me give you the summary overview of what fish surgery is like. The fish come into the office. Usually the owner will bring them or ship them, typically bring them to the office. They go into a holding facility there where they're stabilized. We try to do surgery on fish when they get up into the mid-70s. If it's middle of winter and the fish needs surgery, well, all right. But the problem is, I found early on that when the fish are very cold, like winter temperatures, their immune system doesn't allow them to bounce back from surgery very well. Anesthesia is poorly taken. They don't metabolize it very well. There's just a lot about doing frosty fish surgery that I don't like. So we'll get the fish in and we'll stabilize them in the low to mid 70s, and then surgery can be endeavored. I would say this one thing: people wait too long on surgical options for their fish. They watch the fish wasting away and try different medications and stuff. And egg impactions, people start squashing on them and rupture the egg case inside. The fish looks a little bit better for a minute, and then once the eggs start rotting inside and the organ damage is discovered, the fish starts to slide. Then they bring it down to me for surgery, and I open it up, and there's a disaster with fibrin and infection and all that other stuff going on in there. If the fish is worth much, you should seriously think about surgery in advance. So, I don't know, what would somebody's question be? How do you anesthetize the fish? You would basically put the anesthetic, and I prefer the oil. You put the anesthetic in a plastic bag with some water and shake it like crazy to mix that oil up in the water, and then you distribute that oil emulsion in the water with the fish with an air stone, and the fish will fairly quickly become sleepy and go to sleep, ready for surgery. When the respirations, in other words, the gill fluctuations, are very rare and the eyes are largely unresponsive, that would be a decent plane of surgical anesthesia, and you're ready to get moving. Now, as far as keeping fish alive during surgery, that's a simple matter as well. You can use water. I use 3 different flavors of water. I use water that is very anesthetized. That's the water that the fish actually went to sleep in. Then I dilute some of that water halfway with regular water from the holding facility. so that it's half strength, and then I have fresh water. And then I have a water pump, that I can drop into any of those 3 waters, so that if the technician that's keeping the fish asleep, if I say I need this fish deeper, they can put the pump into the heaviest, most anesthetized water and pump that water over the gills. I used to go through the mouth. What I found with that, though, if you look really closely, is that the water goes in the mouth and then sort of over the ventral or lower gill arch. The upper gill arch doesn't get much water at all and can be damaged by that. So the best way I have found to anesthetize is to lift the gill cover and then have the technician insert the tube that you're pumping the water through under the gill cover and onto those gills. I've seen it done a whole bunch of different ways, and I think everybody has their strengths, and hopefully everybody's doing it in a way that is successful. If there's a problem or if it's not successful, do consider lifting the upper gill cover. If the fish is on its left side, for example, lift the right gill cover and just dribble the water over the upper gill. It runs down onto the lower gill, and you don't have to worry about putting a tube into the stomach accidentally, because that's kind of an issue sometimes. So the fish is sleeping. You're using 3 different flavors of water, from plain water to heavily anesthetized water, and as the fish gets lighter or deeper, you can move the pump from tub to tub, and then it's time to do surgery. That was a huge learning curve as well. There was the, do you cut through the scales, especially on a koi, and the answer is no. I found the healing was terrible trying to preserve scales, like really terrible. Once you cut a scale and you go through the base of a scale, the scale dies anyway. And when you try to suture through a scale, it's just extra time and extra aggravation, and it kills the scale as well. The best healing I get is when I go and through the incision line where I want to cut, I'll pull the scales in that line, and there's usually 3 overlapping scales for one line, and I'll pull the overlapping scales to gain access to plain skin. It doesn't really damage the skin as much as you think it would to pull the scales out, but I get the area cleared off of scales, and then I go in through that site, and then when I close, I utilize through and through stitches and close where those scales aren't. And it's easy to put the stitches in too tight. You got to make sure that you don't. They have done some studies to show that the best suture material that you can use happens to be non-stranded. It's like a monofilament is the best, which is kind of funny because our monofilament nylon is not unlike monofilament fishing string. In fact, sometimes I think that the monofilament fishing strings are stronger than what we have available to us as far as suture. You want to use a tapered needle and not a cutting needle. What else? Multiple, like 7 or 8 small sutures are better than 2 or 3 large sutures. The objective when you're closing is, if possible, try to waterproof the abdomen so that water can't go in and out through the incision line, although to a certain extent it does anyway. We used to, and I'm not sure it was a bad idea, we used to sew up the fish and we'd blot dry, and then we would put, where appropriate, we would put some super glue. In the veterinary side, it's fancy. It's cyanomethacrylate glue, surgery glue, and they've tinted it blue so you can see where it goes. And then those are nice touches, but it also more than quadruples the price. But so we would often go in and then we would close using a monofilament, lightweight monofilament line, multiple small stitches instead of 2 or 3 big stitches, and then put a little bit of super glue on those areas that might be allowing water in and out. The super glue peels off relatively quickly. It's not something that you ever have to go in and remove. You don't want it in the line. You don't want it holding the line together. You want to put it on the line that is already put back together again. Stitches out. Yeah, you want to get the stitches out sooner than you would think. The longer you leave them in, the better your odds of having an infection. Every place where the suture goes through the skin is a place that's going to create inflammation, which can lead into infection. And the tissues of a fish happen to heal very quickly. So some of those incisions, and hopefully I'll be able to put some of the pictures of healed incisions up pretty quickly on this video. Those fish heal up pretty well and not ugly for the most part. And it turns out when you pull those scales, the body is able to generate fake scales. I don't know how to describe it. They're thin, flimsy, about the same size as a regular scale. And maybe in years they go back to being a regular scale, but they look like a scale, but they're soft and rubbery. That's about as far out as I've followed them, because we always return the surgeries to the owners, so I don't get to see them a year or two later. The fish that I was doing spays on for surgical experience, those fish, I kept a lot of them, and then over the years they went different places, and I didn't check their incisions with any frequency at all. But another surgery that we do is not just in the abdomen. Surgeries to remove tumors and growths from fish. Surgeries to remove eyes that have been irreparably damaged. Surgeries to improve mouths that have been damaged by mouth rot. Split fins, although I found repairing split fins is kind of... When I say not profitable, I don't mean from a financial standpoint. I just mean from actually doing something for the fish standpoint. Most fish don't need surgery to fix the fins. They'll fix themselves. But on occasion, you feel like sewing some fin rays together. It's a little tricky. It takes a figure 8 pattern. You can't pull the stitches too tight. If you so much as sneeze while you're sewing it up, you'll pull the flesh out from between the rays. Even on a biggish fish, I really prefer not to suture up fins, but, it can be done. Your last stay suture gets held in place with a drop of super glue that keeps it from tearing out, but most of the stitches fall out anyway. I've used simple continuous and simple interrupted stitches with variable degrees of lack of success. I really think unless you're dealing with a show fish and willing to risk it, we're looking worse. I think suturing fins up might be something to pass on. Once the fish has had its surgery, you move it into a tub or holding facility with clean water with a lot of aeration. And there's a couple reasons for that. And the fish will shortly kick out the anesthetic from its bloodstream and wake up. So the reason that you increase aeration of the water during surgery that you're pumping to the fish and in the holding facility is because the fish's metabolism is very, very slow. The heart rate slows down, respiratory rate slows down, and more than that, while asleep and in the holding facility, the gills aren't really moving. So moving fresh water over the gills isn't happening with the efficiency that it would if the fish closed its gills and opened its mouth, and then closed its mouth and opened its gills to move more, statistically, a lot more water over the gills. So the fact that the fish is respiratory compromised means that the water should, if at all possible, have more oxygen in it. Also, as the fish lays there, its bloodstream accumulates carbon dioxide, which has a tendency to wax towards carbonic acid, and the prevailing condition for fish under anesthesia is one of acidosis, of falling pH, and keeping oxygen levels as high as possible is one deterrent to much damage from the CO2. And then there's an anesthetic called MS-222, which happens to be an acid, and it drops the pH of the water considerably. And there's another reason that you might want to support the pH in an upward direction with a buffer. With oil of cloves, that's not necessary. The reason I like oil of cloves, like I said, is it's easy for you to get your hands on. You can get that at almost any drugstore. The dosing is pretty good. It's quite safe. So let me talk to you briefly about safety on oil of cloves because it's sort of an interesting thing. At the end of labs, I host wet labs from time to time. They're arduous and intense. But in those wet labs, a lot of times we want fish that we can use to biopsy and anesthetize so that they don't suffer. And so they go through these procedures, and we biopsy them and find out what kind of parasites they have, and we discuss what the solutions and cures are and all of that. And at the end of the lab, these fish sometimes are not supposed to be released. For example, if you catch fish at a rye patch in Reno, Nevada, you can't release them again. Ostensibly, Fish and Wildlife Service looks at them as potentially contaminated with ornamental fish diseases, and you can't put them right back into rye patch reservoir and contribute disease there. Those fish are supposed to be destroyed. Okay, fine. So you go to destroy them, and I can remember the first year we decided to do that, we tried oil of cloves, the anesthetic that we were using in the lab. And so we put the oil of cloves in with those fish in less water with 3 to 4 times more oil of cloves than you're supposed to use for general anesthesia. And the fish went down, and the fish stopped breathing and flipped over and everything and died. Yeah, not really. Effectively, they did. We thought that they did. We were the next day. We were pouring water out and removing the fish to plastic bags and getting ready to discard and all of that. And it was noted that some of the fish, after 24 hours, were still alive, drenched in near concentrated oil of cloves. And when I say still alive, I'm not talking about flipping and flapping and all that. I'm talking about like, hey, this fish isn't stiff as a board. I wonder if it's still alive. So we moved the fish back into fresh water, and I would say all but maybe a half a dozen out of 70 fish didn't die. So oil of cloves as a euthanasia solution isn't fab. So, and then a word on that. Heck, why not? I've got time. Hopefully you do too. Oil of cloves as a euthanasia solution isn't very good. However, it still has its place. So one way to euthanize fish, to kill fish that are suffering or irreparable or can't be released because they're a contaminant hazard or whatever, one way to eliminate those is to freeze them, because they're cold-blooded animals and all of their biological functions are controlled by enzymes. And as such, when they get very, very cold, especially when they get cold very quickly, 10 to 20 degrees drop in a very short period of time is enough to put them into a coma, a real coma, because the enzymes for respiration and muscle movement and all of that, those enzymes are not adapted to cold water during the summer. And so if you chill them rapidly, they slip into a coma. They don't function. And they don't feel anything. Well, they barely feel anything in the first place. It's been argued that since they do not have a spinothalamic tract, that's the part of the brain that allows you and me and monkeys and dogs and cats and hamsters, that would be higher vertebrates. That's the spinothalamic tract, is that little strip of brain that takes pain impulses to the surface of your brain to interpret as being very bad or not so bad, or just a little uncomfortable. The fish doesn't have that, so it doesn't subjectify that. It can feel a sensation. It has a general idea that somebody's handling it, and that is instantly upsetting to the fish. They don't like it. But as far as being able to, quote, feel exquisite pain, not so much. Do I want to believe that? Do I want to bet on that? Would I bet that is true? Or maybe if it was super easy, maybe wouldn't I just take like one step to make sure that I was right? So I treat the fish like they have a spinothalamic tract. I treat the fish like they have pain receptors of the most excruciating kind, deep and superficial pain. And when it comes to euthanasia, if I'm going to freeze them so that they don't experience anxiety about being frozen or stuck in a dark freezer, I'll just anesthetize them with oil of cloves. No big deal. And they'll go out in a bucket or whatever, and then when the fish are completely asleep, the minimal respiratory movement, and all on their sides or backs or whatever, then I will slide them into a plastic bag or a shallow bowl of water and put them into the freezer. And that's it. But as far as relying on oil of cloves to kill a fish, sure, it can happen, but that's probably not going to be the case. It's an issue of time, obviously. If you've got the fish in way too much oil of cloves for a long time, they're probably going to die. Or if you've got the fish under too much oil of cloves, maybe you're not aerating the water, and the fish is very weak to begin with, it's going to die. Some fish don't need much handling at all to die if they're already in a very weakened condition. I have a picture, which I don't know if I'll find it for this video, but I have a picture of a fish that is so bad off, it looks like it's dead already. It's just an example picture of a fish that has no chance of survival. It would be a good candidate for oil of cloves and a trip to the freezer. So, anyway, so in a video regarding surgery, I think I've covered a pretty good bit. That is how we'd anesthetize fish. My favorite anesthetic being oil of cloves, that you mix it up in a bag, mix it with the water, keep it well aerated, the fish goes to sleep, then you pump that water and then some clean water and an intermediate type of water over the gills on its side. Do your surgery, which could be an intra-abdominal surgery or a superficial surgery, removing a tumor from the skin. I didn't get too much into that. And then recovery in a holding facility, which is well aerated with clean water, and a very high degree of success with oil of cloves as an anesthetic. So I think that covers a lot of what you might otherwise cover on a fish surgery video. As I do surgeries in Marietta, what I'll do is I'll document those with video and I'll post them on my YouTube page. It would be nice if you subscribed so that you could get those notifications. Also, I'll be putting up other videos with interesting cases over time. And I look forward to having you in the subscriber family. Right now I have, the date of this video is like mid-December, and I have 2,410 subscribers. Maybe someday I'll have 1 million. Anyway, thanks for tuning in, and take care of yourself.